This presentation is going to be on transcranial direct current stimulation and the effect that it has on Alzheimer's disease. Before we can discuss the effect TDCS has on Alzheimer's, we have to understand what Alzheimer's is. Alzheimer's disease is the most common form of dementia, affecting up to 70% of dementia patients. An image of a healthy brain versus a brain affected by Alzheimer's has been inserted on the slide to help demonstrate the effect Alzheimer's has on our brains. In a healthy brain, all the areas of the brain are connected by synapses. The brain cells communicate through synapses, which then enable our brain to communicate to the rest of the body. The areas of the brain that are involved in memory, which is what is impaired when you have Alzheimer's, is our temporal lobe, hippocampus, and cerebellum. These areas are involved in working memory, forming new memories, and muscle memory. A brain affected by Alzheimer's looks very different to a healthy brain. There are two types of brain lesions found in Alzheimer's, the first being amyloid plaques, which impair the synapses so that signals cannot pass between brain cells, and the second one being neurofibrillary tangles, which kill the brain cells by preventing the normal transport of food and energy around the brain. The loss of neural synaptic density eventually leads to a decline and degeneration in the brain. Currently, drug therapy is the main form of treatment in Alzheimer's. However, there are some issues with drug therapy involving the blood-brain barrier. The blood-brain barrier protects the brain from infection. But if the brain does become infected, it is difficult to treat, as many antibiotics are too large in their molecule structure to cross the barrier. This is a major problem when finding agents to treat Alzheimer's disease, as they must pass this barrier to treat the brain. Hence why TDCS is being considered more and more these days. Transcranial direct current stimulation, or TDCS, is a non-invasive neuromodulatory technique that exhibits a low electric current to the scalp, measuring cortical excitability through brain polarization. The weak currents measure at 1 to 2 milliamperes. Two large electrodes are soaked in saline and are placed on the scalp. One electrode is a nodal, which increases the excitability of cortical neurons, and the other is cathodal, which decreases this. This is often performed for 20 to 30 minutes. The direct current of the electrodes affects the resting membrane potential and the neuron firing rate. TDCS has the ability to modulate synaptic strength that has broken down when one has Alzheimer's. It has been stated in a lot of literature that the rhythms of the electrodes involved in TDCS are unable to stimulate large structures in the brain, such as the hippocampus and cerebellum, which are key areas of the brain that are affected by Alzheimer's. Many experiments that have focused on TDCS and Alzheimer's have focused their attention on altering tasks that involve working memory, selective attention, and recognition memory. Majority of experiments that have been conducted involved the electrodes being placed over the prefrontal and temporal areas. Regardless of the fact that it is thought that TDCS is not able to stimulate large areas of the brain, these experiments have demonstrated a significant short-term improvement in memory tasks. There were limitations found within the literature. All of the experiments reviewed were only focused on the initial effects of TDCS. No patients had follow-up exposures, and no researchers had followed up whether the effects had lasted longer than a few hours. Another problem was that all experiments studied used bipolar stimulation, meaning that there were two electrodes placed onto the scalp. It is unknown whether the effects may have been from the stimulation from the opposite electrode. In terms of future directions, further experiments should be carried out examining the difference in effects due to bipolar and monopolar electrode use. Extra research also needs to be done on whether repeated exposure to TDCS will increase the long-lasting effects of brain stimulation, or whether it will negatively affect patients. TDCS is more cost-effective and a less invasive possible way of curing Alzheimer's. Since all experiments demonstrated short-term effects in memory, it is worth making future improvements and studies to see if this is an effective long-term treatment for Alzheimer's.